out of West Hartford.
Okay. And what type of services do you provide?
We provide support groups for both people with mental health conditions as well as their family, friends, caregivers.
Okay.
We provide education classes for people with mental health conditions as well as their caregivers, as well as workforce, veterans, providers. We do legislative advocacy. I'm actually a registered lobbyist, so I spend a lot of time up here at the Capitol. Working with various coalitions right now. We're working with the Husky Sea Coalition, trying to fix that disparity and other items on our list.
So how do you determine what type of person gets services for mental health? They have to be diagnosed by a doctor first?
No.
Are there services also for immigrants if they're struggling and they don't have any medical?
Most of what we provide is free, so yeah, that anyone who wants to approach us, who has lived experience, either again as a caregiver of someone with a mental health condition or has a mental health condition, is welcome to avail themselves of what we do. Because again, most of what we do is free. Really, the only things that we ever charge for are a couple of our education classes that are actually from other entities. They weren't created in-house. Anything we've created in-house is free, typically. But like our provider ed, we always get a little bit of a stipend for that one. If we're doing like QPR suicide awareness prevention training, we have to, that material wasn't created by us. It was created by QPR Institute, so we charge for that. But it's all nominal. But again, the vast majority of what we do is free.
Okay. So when somebody comes to you and look for help, you refer them to a psychologist, psychiatrist, you send them to a...
We can do that. That's not a real focus of what we do. We're really just kind of wrapping around what people may avail themselves with by having a psychiatrist or a therapist or a doctor or what have you. We provide the support.
Okay.
So
what type of support? When you say support, you're like...
we have the support groups that are all facilitated by people who are not just trained support group facilitators, but most importantly, people with real lived experience. So like when my son was struggling with his bipolar disorder and my wife and I didn't know what to do, we went to a family support group. And it was facilitated by other parents who had a loved one with a serious mental health condition, and they helped us out because they knew exactly what we were going through.
And that's what NAMI provides right now, is a support group.
Support groups and education classes, and again, we do classes on legislative advocacy, because again, that's one of our three charters: support, education, and advocacy. So again, I'm a registered lobbyist. I do come up to the Capitol as well. I'll be up here tomorrow for a rally from the Connecticut Nonprofit Alliance. During public hearing season, I'm up at the Legislative Office Building in public hearings. So that's our three main focuses: support, education, and advocacy.
And if anybody wants to contact you, this is the website and this is the brochure they can get all the information from.
Yeah, our website is NAMICT.org, so that's NAMI as in National Alliance Mental Illness, NAMI, Connecticut, CT, so NAMICT.org.
Okay, thank you very much for your time, sir.
Hey, you're quite welcome. I hope the video comes out good. It's kind of noisy in here.
Yeah, it will. Thank you.
Thank you.
All right.